Living longer, living healthier, living better than ever before. Welcome to Mountain Pacific's Healthy Living for Life, a weekly series that gives you the information, education, and expert insight you need to become an active participant in today's ever-changing healthcare climate. Here now is today's program host.
As we age, we tend to take more and more medications to treat our health conditions. But using multiple medications puts us at greater risk for harmful adverse drug events. There are 3 types of medications that can be especially dangerous. Welcome to Healthy Living for Life, a show dedicated to helping you do just that. I'm your host, Lisa Sather. Today we talk about the big 3 medications for adverse drug events and what you need to know if you're taking them. Stay tuned. Welcome back and thanks for staying with us. According to the Centers for Disease Control and Prevention, adverse drug events are responsible for more than 700,000 emergency room visits every year. And if you're over the age of 65, you're twice as likely to go to the ER for adverse drug events and almost 7 times as likely to be hospitalized after an emergency visit. Joining us this morning is Angie Woodmansey, a pharmacist with Mountain Pacific Quality Health. Angie, thank you for being here.
You're welcome, Lisa. Thank you.
Absolutely. So before we dive into this conversation, I think it's important to take a step back and make sure folks understand what an adverse drug event is. Can you define that for us?
Sure. Adverse drug events are any injuries or harms that may happen to someone as a result of taking a medication. It can be a broad spectrum of adverse drug events. It could be anything from a medication error where, let's say you go to the pharmacy and fill a prescription and you come home and realize you got the wrong drug. Mm-hmm. It can be an adverse drug reaction, which is a side effect where you get a medication and you start taking it and you feel drowsy and dizzy. That would be an adverse drug event. Also, drug interactions. If you're taking 2 medications and one medication can make the other one not work as well, that's also an ADE. And then lastly, overdoses. They can be accidental. You know, you can get your prescription bottle, look at the directions, think you know how to take it, and then you realize later, oh my gosh, I took double the dose I was supposed to take. So they can be usually, not intentional, and they can be very frequent.
Excellent. So can you give us some examples of actually where ADEs may occur? What types of situations,
Sure. Unfortunately, adverse drug events can happen anywhere. In the healthcare setting, you can see it happen in hospitals, it can happen in nursing homes, it can happen in your own home. As I just described, you can read your prescription drug bottle wrong. Another area where it can really happen is with transitions of care. So if you've been hospitalized and you're getting discharged to home, your hospital doctor might write for a whole slew of new medications. And you go home and there you have your old medications and you might think, oh, I'm supposed to take both because your doctor didn't know you had those others at home. And of course that could lead to drug interactions or compounded, they could be very similar drugs and you could take too much.
Sure.
So that could be a problem. Another community that might be at risk would be rural communities. Oftentimes they are lacking appropriate healthcare providers, they just don't have enough.
Sure.
And anytime you're in an underserved situation like that, adverse drug events can be more likely.
I understand that unless we do something to the number of adverse drug events is anticipated to continue to grow, as time progresses.
Yes.
And I'm assuming there are multiple reasons for that. Can you talk about that?
Yeah, there basically are 2 major reasons. The first reason would be that as we age, we take more medications. Sure. And right now we have the largest generation, the baby boomers. They're reaching an age now where they're seeking health care, maybe getting put on medications. So we just have a large number of people on meds right now. And then the second reason would be that there are a lot of medications that are now on the market. Every year, more and more get released to the market. And last year, they had almost it was like a 21-year high record. They had 46 new novel medications released, which was double from the year prior. So just with more people, more drugs available, it just sets us up for more adverse drug events.
That makes sense. So can adverse drug events be prevented?
Well, they can not be prevented completely, but there are certain things that we can do to try to reduce our risk, especially as doctors and pharmacists. And so doctors have moved to computerized order entry programs, which have been very beneficial in reducing some errors. When the pharmacist gets that script, they don't have to interpret the handwriting and all of these things. So that's one way. Doctors also, at every appointment with a patient, they really should do a complete medication list. They should ask you about your over-the-counter medications. They should ask you about your natural supplements you might be taking to make sure that there aren't any problems or drug interactions there. As pharmacists, we can play a great role in educating patients about their medications, all of the side effects that could happen, making sure they understand the regimen and how to take it. We also look for drug interactions. We can also screen for any types of side effects. And so our job as a pharmacist is to make sure that what you get on your bottle is correct and that what is on the label is really what's in the bottle. And so that is our job, and we need to look at how we can prevent errors in doing that.
Excellent. So how about patients? What can they do to help avoid adverse drug events?
Well, probably the biggest thing as a patient is to keep a list of all of your current medications. You know, the over-the-counters, the natural supplements, vitamins, you name it. Put it on your list and carry that list with you. Keep it in your wallet or in your purse so that you have it. And take it to your appointments, take it to your pharmacy if you need it. And also make sure that someone you know knows about this list and knows where you keep it in case you have a medical emergency and can't speak. They can just pull it out and say, these are what that person is taking. Another way to reduce risks is just be an advocate for yourself. Yeah. Ask questions. You know, when you get a new medication prescribed, ask why. Ask could be some of the side effects. Should I take this with food or should I not take it with food? You really want to look into all of those types of things. And also ask if your drug might need any frequent blood monitoring and just really be an advocate.
Excellent. So what about those folks who are on a lot of medications? Are there any tips that you might have for folks to help them stay organized and keep their medicines straight, even knowing that some of those medicines might look exactly the same? Yeah,
it can be so confusing. And you know how I mentioned that list?
Yes.
I recommend even on that list, maybe even sometimes making a little visual chart for yourself. Like, okay, in the morning I take these meds, in the evening I take these meds, just to map it out and see it, especially when you're starting a new med. And then, of course, pill box organizers are very helpful. They can have AM and PM boxes, and it can kind of help you keep it straight. You fill it once a week, and then that can tell you if you've missed a dose.
Wonderful. We're going to take a quick break.
Okay.
We'll come back and talk some more in just a couple of minutes. Stay tuned. We'll be back shortly.